breastfeeding is very important because it carries a number of benefits. But of course, not every woman uh, actually understands the benefits of breastfeeding. And that is why global initiatives on promoting breastfeeding actually become very important. One of the key things that happen at a global stage is what we call the breastfeeding week. So what happens in the breastfeeding week? It's about promoting breastfeeding as an important or very important strategy in preventing, I mean, in preventing infant mortality. If a child is actually breastfed well, then they are likely to live, okay? They are not likely to die, okay? And including all the other benefits of breastfeeding that we can talk about. So let us look at these global initiatives. That means that breastfeeding is an important topic for people who want to promote health among populations because breastfeeding improves the survival of children. Okay, it has social, economic benefits and also health benefits, and that's why we expect that countries should be able to promote breastfeeding. So breastfeeding is not a discussion that we can only have with mothers. It is a discussion that we can have with everyone who is concerned. Why? Because women actually give birth and breastfeed these children. But if they are working women, how do we make sure that they can continue breastfeeding their children even at the workplace? What what kind of environment do we have? Do we have lactation rooms at our workplaces? Can they breastfeed their children quite well without any disruptions? That is why looking at global initiatives that promote breastfeeding actually become very. So the things that we should look at, one is that within any given country there should be a national broad breastfeeding coordinator, and then two is that we need to implement guidelines, and these guidelines come from what we call baby friendly hospital initiatives. And then three is that there should be what we enforcement of international code of marketing breast milk substitutes. Okay. Okay. And then the last thing that needs to happen is that there should be regulations that protect breastfeeding rights of working women. These are things that I've just talked about here. So when we talk about baby friendly hospital initiative. So this initiative was launched by UNICEF and WHO in 1992. What this initiative aims at, it aims at promoting breastfeeding through maternity care services. So facilities need to implement 10 steps for successful breastfeeding to happen. And these steps are here. They should have a well-written breastfeeding policy. They should train staff on breastfeeding, and there should be antenatal breastfeeding education. They should also initiate breastfeeding within 30 minutes. They should support their mothers with breastfeeding and lactation, and then no supplements until they are medically recommended. And the child and the mother should be allowed to bond within the first 24 hours. Okay, so roaming in 24/7, very important. And then breastfeeding on demand, no artificial teats or pacifiers, and then also establishing support groups and referrals. These are the 10 steps that need to be implemented to promote successful breastfeeding in maternity settings. Okay, and then we have the International Code of Marketing of Breast Milk Substitutes. Why is this very important? We have people who are interested in marketing their products. They're basically saying that these products can serve as substitutes to breast milk. But if this is not done according to ethics, it can be exploited. So the marketing of these substances should be should portray the right information. Okay, and that is what is very important, because you can have people rushing in to buy these substitutes such that the sellers actually benefit commercially. So this marketing should be in conformity with the codes. Okay, so what are those what are the international uh, guidelines on marketing these breast milk substitutes? One, no advertising on substitutes, bottles or tips, nothing. Uh, Two is that there should be no free samples to mothers should be given, no promotion in health facilities. There should be no contact between marketeers and mothers, no gifts to health workers. The labels must discourage artificial feeding and be in appropriate language. Only factual information should be provided to health workers. The World Health Organization resolution on the code: one, discourage the use of follow-up milks and encourage complementary feeds. Two, prohibit donations of breast milk substitutes. Talked about that. Promote independent monitoring of what is basically happening. Ensure that the health worker are not influenced by funding or gifts that they receive from these companies or organizations. Emphasize that continued breastfeeding. Emphasize continued breastfeeding with complementary feeding from 6 months. Okay, so complementary feeding is when a mother is expected to breastfeed for 6 months exclusively, exclusive breastfeeding, no nothing. Okay, apart from drugs. At 6 months, they can introduce other feeds, and that is when we talk about supplementary feeding. So supplementary feeding is also very important to meet the requirements for growth, development, and health. So these requirements are based on UNICEF. Okay, so we have talked about that. Responsive feeding. What is responsive feeding? In this case, we are saying that feeding children should be done appropriately, and this should follow the following guidelines. One is that the children should be fed directly, and if there is assistance, that assistance needs to be provided to these children such that they can actually feed well. Responsive feeding also should be sensitive to hunger and satiety cues. There are things that you should see in a child and know that they actually need to feed. Children need to be fed patiently and slowly, such that the food is not forced onto them. Minimize any distractions during meals. Things like watching TVs or being on the phone are actually not encouraged. Talk to the child and maintain eye contact. These are very important in what you call responsive feeding. If foods are not well prepared, they can be contaminated by germs, and that can result into infection. So it is very important that food is prepared in safe vessels or utensils, and the proper hygiene practices are actually implemented. Avoid feeding using bottles. Serve food immediately after preparation. Use clean utensils, cups, and bowls. Wash your hands before preparation, and also before eating. How much food do you need to give to the child? How much complementary food is needed for the child? At 6 months, of course, the child needs to be introduced to these foods slowly, and as they get used to this food, the amount is actually increased. A child who is 6 to 8 months, 200 kilocalories per day can be sufficient. 9 to 11 increase to 300 kilocalories per day, and then 12 to 23 months increase to 500 kilocalories per day. What is very important for when introducing these feeds is that you start with soft foods, and then later the texture increases. Okay, so you start with mashed food at 6 months, and then finger foods, family foods, and then family foods by 12, and then finger foods by 8 months. Avoid this food texture is associated with choking. So to avoid that, give them small foods, soft. How many meals in a day? 2 to 3 meals in a day. Or for 6 to 8 months, 2 to 3 meals are sufficient. For 9 to 24 months, 3 to 4 meals are sufficient. And in between the meals, you can give them some nutritious snacks. Okay, the foods need to contain vitamins, carbohydrates, minerals, proteins. Supplements can be given when needed, but most importantly, the mother should continue to breastfeed. Okay, the mother may also need some supplements, and they may be important, especially before pregnancy and also during pregnancy. Folic acid and iron, these are some of the supplements that these mothers need to receive.